Pulse oximetry provides both qualitative and quantitative data. The qualitative data are obtained through the sounds emitted by the pulse oximeter. These sounds correlate with the level of oxygen saturation. A higher pitch indicates higher oxygen saturation, and a lower pitch warns of decreasing oxygen saturation. The pulse oximeter provides quantitative data through the display of a pulsatile waveform that corresponds to the flow of arterial blood. The numbers displayed indicate the hemoglobin oxygen saturation and the pulse. It is important to adhere to standard precautions before any contact with patients. Hand washing is the single most effective strategy to prevent the spread of infections. The ideal site for placement of the pulse oximeter probe is one that is well perfused, relatively immobile, comfortable for the patient, and easily accessible. The earlobes and the fingers are commonly used sites. Feet, cheeks, nose, and tongue may be used in cases of low peripheral perfusion. In adults, the probe can be placed on either side of the body. In newborns, however, placement on the right upper arm is preferable because of the possibility of a patent ductus arteriosus. Blood flowing to the right upper arm is the least diluted by the shunt and is therefore the most oxygenated. It is important to choose a probe that is the right size for the patient. If the probe is not the right size, the light-emitting diodes may not line up correctly with the photodetector and will provide inaccurate data. For example, a probe that is too large for a patient's finger may slip, and the light may not pass completely across the finger. Venous pulsations may occur if a probe is too small or is placed too tightly on the finger. These venous pulsations will produce interference, resulting in a falsely low pulse oximeter reading. Pulse oximeter probes with adhesive sensors may minimize motion and may yield more accurate results than non-adhesive sensors.